Shin splints. You may have experienced it yourself or at least heard of a complaint called shin splints. It's quite common, especially related to higher impact activities like running or dancing. Now, shin splints is a type of shin pain usually caused by exercise. Now, generally it's not too serious. However, if left untreated and ignored and carrying on with impact activities, it can lead to a more serious injury called a stress fracture. Shin splints causes pain and tenderness along the front of the lower leg, the shin area. So what are the different types of shin splints? Well, there are three main types. You have medial tibial stress syndrome, which is basically the bone and muscle, which is very sore to touch along the inside area of the shin. Secondly, you've got tibial stress fracture, which is on the bone itself, on the top and front of the spine of the shin bone, which is also very sore to touch. And thirdly, you have compartment syndrome, which is the muscle on the outside muscle of the shin, which tightens up when running. Bone-related shin pain is a lot more common than muscular shin pain. If it is muscular, then some foam rolling on your shins and your calf muscles will help loosen the area. Plus, consider some arch and insole supports for your shoes. So what causes shin splints? Well, shin splints are caused by repetitive stress on the shin bone and the connective tissues that attach your muscles to the bone. It's very common if you suddenly start doing a lot of exercise, having not done much for a little while. So please be careful at this time. In other words, you've got more time at the moment, and if you're looking to step up your running or your HIIT training, then just be very careful. Also, jogging or jumping impact on hard surfaces and bad running technique can cause shin splints. So in summary, it's normally the result of three main variables. Firstly, your body mechanics, your foot position and how it strikes the ground, and your overall body strength. Secondly, it's the amount of activity and your rate of increasing this amount. And thirdly, it's your bone density, and this can be a big factor for women. If you catch it fairly early and carry out the right things, then shin splints usually gets better within a few weeks. So if you suspect that you have shin splints, what you should do to help this is the following. Number one is, first of all, stop doing the exercise that caused your shin splints in the first place, and switch over to more gentle exercise such as yoga, stretching, swimming, just generally to allow the healing process. Secondly, put on an ice pack or some frozen peas for up to 20 minutes at a time, every maybe 2 or 3 hours. Just place the ice pack with a towel in between that and your leg and hold on. Thirdly is take some paracetamol or ibuprofen to reduce the pain if you're okay medically to take these. Fourthly, make sure that you warm up and cool down with stretching thoroughly. Fifthly, when you can start to lightly impact again, just make sure you exercise on soft ground. Also make sure you have a good pair of trainers or shoes that support your feet so when you move around you're okay. And also, don't rush back to intense impact exercise. Build it up slowly. If you start to work out before your shin heals, you may end up really hurting yourself permanently. Now, most cases of shin splints can be treated with rest, ice, and just re-strengthening. So if you do have shin splints, then the pain should stop when you actually stop exercising. However, if it does carry on continuously, then it might end up progressing to be a stress fracture. So if the pain's not slightly improving by carrying out some self-treatment, it is recommended that you do see either your doctor or a physiotherapist as soon as you can. It's not possible to generalise about when your shin pain will go away exactly, but it does depend on how it was caused in the first place, and also everyone is different in terms of recovery rates. It can be a few weeks, up to 6 months in fact. I can highly recommend Sports and Spinal Physiotherapy, and I've included their contact details in the text. And if you're suffering with shin splints, do message them and they will help you. They'll also make sure that you don't have a stress fracture, which is basically tiny little cracks in your tibia or your shin bone. Generally, let pain be your guide. Prevention is always better than cure. So how do you help prevent shin splints? Well, firstly, if you're running a lot, then it's definitely worth getting your running movement analysed. Again, I can recommend Sports and Spinal Physiotherapy, who basically can do this for you. Once you've done this, then you can also make sure that you choose the best possible running shoes for you. If you are a runner, you should be replacing your shoes about every 350 to 500 miles. Also, if you have flat arches, then to wear some arch supports can greatly reduce the pain, and wearing sometimes some shock absorbing insoles can also help. Secondly, to prevent, don't overtrain too much. Don't do too much running or too much high impact exercise that can overload your shins. Consider introducing different types of activity to cross-train your body. In other words, vary away from the same impact activity that you always do. This will help reduce the risk of overuse. So, for example, if you run a lot, then consider introducing some walking, cycling, swimming, rowing, or a cross-training machine just to reduce down some of the running. When stepping up your training, only increase also by around about 10% increases in your mileage per week. Also, strength training. Look to carry out a minimum of 2 times per week for your whole body, especially for your core and your hip area. And make sure that you carry out also some calf raising exercising a number of times per week. Actually strengthening the muscle of the shin itself will help you, but also bear in mind muscles work in pairs, and strengthening the opposite muscle will help your shins cope with the exercise that you put them through. Put very simply, if your surrounding muscles are strong, it will also help the body become more resilient to overuse and impact injuries. Also, follow a good diet and make sure you have a good level of calcium and vitamin D. Good general food choices with this include milk and yogurt. Plus, you could consider taking maybe a supplement for these as well. Also, shorten your running stride. This will put a lot less stress and load on your weight-bearing joint areas, so your feet, your knees, your shins, and generally all over your body. It would also be useful to count your foot strikes on one side for, let's say, 1 minute. A good number is 85 to 90 strikes of 1 foot per minute. So finally, let me show you some good strength exercises that will really help you both prevent and rehabilitate from shin splints. I'll just turn the chair around so you can see. The first one is really a point and pull, where you basically point and pull your foot. So point and pull. You would do this maybe 10 or 20 times. The second one is with your foot down the floor, simply pull your toes up, leaving your heel down, and then relax it down. Pull your toes up Both of those mobilise the ankle and strengthen the shin. And finally, of course, a calf raise. So again, tuck both feet together. Then you can either do a double calf raise, pushing up high on your toes, squeezing the calf, or tuck one leg behind, keep the legs straight, and then push up on your toes, and then back down again. So a standing calf raise. So there we have it. There's a general summary of how to identify shin splints and then how to improve them either by self-healing and self-treatment, or please don't muck about with it. If you feel they're not getting any better, go straight to the physiotherapist or to your doctor. And as regards physiotherapy, I put details again of Sports and Spinal, who are specialists who can help you with the shin splints that you may have.